We are back. Welcome to Get Your Man On. We are here with Justin Turner, men's sexual health expert, treated thousands, tens of thousands of patients, physician's assistant, worked in men's clinics across the country. Justin, so happy you've been with us. And this is so huge. I mean, this show is all about changing men's lives for the better, seeing positive impacts in men's relationships and their bodies and everything that they touch. And I think learning about testosterone is such a huge deal. It's really our goal for guys to find their edge and be the best guys they can be. And I think it sounds like testosterone can be a part of making that a reality. And it doesn't sound like it's a magic wand per se, but it can just maybe give them that boost, that push to do some of that work to get to where they used to be, where they want to be, or maybe like they never have been before. Do you agree with that?
Oh, absolutely. If in the presence of deficiency, it's hard to be the best version of yourself. And so we restore what they've lost, and it gives them that chance. And then it's on them and on us just to inspire them, which they listen to you enough. I have a lot of confidence they'll find that.
Let's go, baby. Come on, y'all. We're going to man up and get your man on. By the way, go to getyourmanon.com to find a medical practice near you that specializes in ED and low T. Clinics are on that page. Also, you can go there to submit your questions about ED, low T, men's sexual health, or give me a sexy secret confession about a bad sexual encounter or a great sexual encounter or any kind of anything that you can think of. It's all anonymous, okay? It's all anonymous. Don't have to say your name. We're not going to track you. We're not going to do any of that stuff. We're here. We're going to take your anonymous questions. So we have a first question here for you, Justin. How soon does it take for testosterone to kick in?
Yeah, so, I mean, there's an immediate effect. If we're referencing the injections, a lot of guys will feel better in a couple hours. But if it's their first injection after starting therapy, it might wear off after a day or so. And then a week later, they get a second injection, feel better in a couple hours, might last 3 or 4 days. Same on until, 4 to 6 weeks is about what it can take before they're getting a good 7 days worth of coverage. One shot fills up the tanks. It gives them plenty of testosterone, but the body has to have time to put the receptors back in place. When they end up with those low levels, the body just takes them away. You expose them to a normal level, and the body puts them back. So it takes a little bit of time, but there is some immediate response.
Gotcha. So you're saying that testosterone replacement therapy actually causes these receptors to grow back?
Yeah, absolutely. It causes the body to put them back in place. Absolutely.
Put them back in place. Mm-hmm. Wow, that's really cool. All right, that's great. And so it's an immediate effect, and then but in terms of like in the gym, things like that, when would you start seeing effects from that?
I think 4 weeks. I think somewhere between that 3 to 4 week level is where you'd start to notice that you're not as fatigued, not as sore, and starting to get in the gains that correlate to the work you're putting in.
Gotcha. Got another question. Is testosterone going to make me more hungry?
It can. Again, if you increase your activity level, you're going to increase your calorie requirement, and it can make you hungrier for sure.
Gotcha. And so it's important to do some work on the gym to keep off some of that. I mean, you got to eat right, I'm assuming.
You have to eat right. Again, we want guys to putting a guy on testosterone, we've talked about that. That's one thing. We want these guys to maximize it. Eat that balanced diet. Make sure that they exercise, especially weightlifting. That's where they're going to get the max benefit out of it.
Gotcha. Especially weightlifting. Is cardio okay too?
Cardio is okay. Again, I'm a big cardio fan, but as far as studies showing what increases testosterone levels, you need to work the large muscle groups.
Gotcha.
So squats, bench press, the big groups need to be worked.
Gotcha. I obviously do that safely with a professional. Don't go hurt yourself.
Of course.
I'm like, I want to jump out there and try to lift a car up or something. So don't do that. Stay safe, folks. Definitely work with a professional to get that in shape. There's lots of great options out there for online help and things like that. Okay, another caller or voicemail anonymous from our voicemail anonymous line on getyourmanon.com. What happens if I stop taking testosterone? Will I need to take it for the rest of my life? Thanks.
Yeah, I mean, Evan, that depends on what the original cause was. And so we talked about primary low testosterone where the testicles failed. Those guys, unfortunately, will, if they want to have increased levels of testosterone, they end up on it a long time. But the second most common cause is a secondary form where some type of stress in the body causes the brain to not communicate with the testicles. You can see that with stress. You can see that with some pharmaceutical drugs like opiates, marijuana. It's obviously a big causative agent there. And so on some of those guys, you put them on testosterone, let those systems rest and pull them off testosterone. And the body can actually maintain those levels that you've had them set on. The treatment's the same, primary, secondary. You can get a little fancy with the blood work and try to identify which one you're dealing with. But typically, we put guys on testosterone. At the end of a year therapy, we recommend they come off for 6 weeks. After 6 weeks, two things are going to happen. The levels are either going to go up and maintain, and they don't need to continue it, or the levels are going to drop, and they've got a decision to make.
Gotcha. They call that like a testosterone holiday, right?
Absolutely, yeah. I'm a fan of holidays, even for the guys who've been on treatment for a longer period of time. I like a 6-week holiday every now and then with the drug.
Gotcha. Would you do anything else instead, or would you just say completely stop it?
I'm going to talk to the individual patient. I like to completely stop it, but guys aren't going to feel well for 6 weeks.
Oh man!
And so based on the patient and what he's looking for and what he's got going on, sometimes we do make a decision and maybe intervene with Clomid or something that we discussed earlier.
Gotcha. That makes a lot of sense. What give me a good story about treating a patient who's so again, there's a bunch, but one from a few weeks ago, I was walking through a clinic. I heard an interaction with a couple of guys. I walked by the door and there was a gentleman practicing a golf swing. And so I walked in the room and started talking with him over the moon. And he just real quickly told me, he name dropped a few people that he was about to go play golf with, but he shared with me that he had built a successful business. He was later in life and able to work remote from that business, very smart people working for him. And that for the last couple of years, he had opportunities to do things like play around a golf with celebrities, but he had pulled back from it. He had not taken advantage of it. And he had been on therapy with us, about a month or so. And now he was ready to take on all of those benefits of all the hard work he had done and excited about it. He still made the comment that he lost 20 balls every game. But again, that guy had been pulling back from the opportunities he'd worked for. He now feels like he should feel, and he's out there playing golf with friends. And so it struck me. I patted my guys on the back just because of the interaction, but they made a difference in the guys. I'm sure that guy enjoyed that game. But seeing him enjoy the interaction he had with our guys and be grateful for what we'd be able to do for him, it was a big deal. That's a huge deal. I've seen it time and time again where a guy's life has been dramatically changed from taking testosterone, going out, putting some work in, watching his body, his relationships, his mood change. It's pretty remarkable stuff. If you're a man who's struggling with your health, remember that it's okay to ask for help. Whether it's talking to a friend or seeking professional help, which we recommend, going to a clinic, going to getyourmanon.com and finding a clinic near you. There are people who care and want to support you. Folks, we will see you next week. We are going to talk about weight loss, how to lose it with testosterone and beyond. See you then.